Good evening, I'm Michael Gigido and I will be demonstrating on how to give our patient nasogastric tube feeding. So first is we need to verify the doctor's order and then we need to verify the 10 nursing rights. So first is right medication, right route, right patient, right time and frequency, right documentation, right assessment and history, uh, and then right to refuse. So next is we need to wash our hands and observe appropriate infection control procedure. Next is we need to don gloves. Next is we need to assemble all the materials or equipment that we're going to use, such as a syringe, the medication, the next is container, litmus paper, and then normal saline solution. And also the feeding. So the name of the feeding is bolus feeding that we need to insert to our patient. So next that we're going to do is we need to identify the patient, explain to the patient what are we going to do and why is it necessary. So magandang gabi po ma'am. Ako po si Michael Guido. Ako po ang magiging nurse niyo para sa araw na ito. Pwede niyo po bang banggitin po ang pangalan niyo? So, ma'am, mag-i-introduce lang po ako sa inyo ng gamot tsaka ng pagkain. Kasi yun po yung kailangan po nyong i-take para po sa araw na ito. Okay lang po ba yun? After that is we need to give our patients privacy such as closing the door or pulling on the curtains and putting patient warm blanket. Then next is we need to elevate our patient's head 30 to 45 degrees. After that, we need to put a towel into our client's chest. After that is we are going to take some gastric contents to assure if the tube is still into the stomach. By that, we're going to take a plunger and aspirate gastric contents and then we will test the pH level afterwards. But before we do that, we need to kink the tube so that the air will not go through the tube, and then we need to remove the stopper, and then we need to introduce air and aspirate gastric content. And then we're going to put again the stopper. And after that, we will going to test the gastric content if it is acidic. Once the color is color red or pink, it means that it is acidic and we can actually give our patients the feeding. If we are giving the medications to our patient, we need to crush the medications. But if there are two different medications that we need to be given to our patient, we need to put the two medications from a separate container, because two medications has different effects. So assuming that the medication is already crushed and solute with water, we need to put it into the plunger of the syringe. Again, we need to take out the stopper, and then we need to kink or clamp the tube so that there are no airs coming inside. And then next we need to remove this. And then we will be given the formula or the feeding formula to our patient. But first, we need to introduce 30 cc of water or normal saline. We need to put the tube up and down above the stomach so that the flow of the water or the medications or the feeding that we're going to give to our patient is fast. After that, we're going to give the feeding itself. So, before we give our feeding formula to our patient, make sure that the feeding formula is warm or at room temperature, because if the feeding is too cold, the patient will experience cramps, reflux, or the patient will vomit. So it is important to warm the feeding that we are going to give to our patient. After giving all the feedings that our patient needs, we need to introduce again 30 cc of water to clean the tube. After that is we will clamp, or we need to kink again the tube because we're going to remove the plunger of the syringe. So that we need to remove, and then we will put the stopper. After that, we will secure the end of the tube into the patient's body. After that, we are going to discard all the equipments that we have used, especially the gloves. After that, we can give our patient mouthwash. We can provide cleaning of his or her mouth using toothbrush, or giving our patient mouthwash so that the patient's mouth will be clean, because we introduce our patient food and medication, so it is also important for us to clean the mouth. And then we need to instruct our patient to stay in 30 to 45 degrees of an upright position to avoid cramps, reflux, and let's explain to our patient that we need, or the patient needs to absorb the food and the medications before he or she lies flat. So it is important that the patient is 30 minutes to 1 hour at the sitting or 30 to 45 degrees upright position. So, ma'am, tapos na po. Napakain na po kita. So, um, ang wag po muna tayong hihiga ng um, flat po ng kahit 30 to 1 hour po. 30 minutes to 1 hour para lang po mag-absorb po yung kinain nyo at yung gamot po na ininom nyo or binigay ko po sa inyo. Para po maiwasan po natin ang mga komplikasyon or yung mga epekto po na hindi maganda. So, ayun po. Gusto niyo po bang mag mouthwash? Wait lang. Well, mouthwash po ito para po malinis po yung bibig niyo. We can also give our patient, or we can also offer our patient to brush his or her teeth if mouthwash isn't available. So, yun lang po, ma'am. Pahinga na po kayo. So, after that, we need to dispose all the materials such as the gloves and all the materials that we need to dispose. After that is we need to record the time, the frequency, and also if there is any unusual expression and actions while we are giving the food or the medications to our patient. And then also if there is any presence of bleeding and other color of the residual um, residual. So that is all. Thank you.